Hello, everyone, and welcome to the Staff Major Record Review question and answer session. We will get started and welcome. So we've got a lot to get through today, so bear with us as we rattle through this. What we're going to do is break it into three sections. We will do our talking through those and we'll pause for questions in between each of those three sections. So we timed it yesterday and it should be about 45 minutes-ish for talking, so there should be plenty of time for questions from all of you. If you could put the questions in the little Q&A box rather than the chat box, it just helps us manage those. And you feel free to put them in as we talk and we can address them as we get to the big question mark sections. You'll see them as they come up in the slides. If we don't get around to all of your questions today, probably because of time or perhaps because we don't know the answer today, they will all be answered and put up on the website afterwards. So please do put that question in anyway, and we'll address them when we can. So the recording itself, today's event is being recorded. That will also go up on the website for anyone who wasn't able to make the session, or if you want to go back and listen again because we spoke so fast you didn't quite take it in the first time. That will be up as soon as possible, along with the questions. And if you didn't ask a question today or perhaps didn't want to be on the recording, feel free to send training or the liaison inbox a question afterwards and it will get directed to one of us and we can answer it for you. There is also a PDF of the consultation on the website, so a couple of people have been asking. That one is now up on the website, so feel free to go download that if it helps you answer questions in between passing it around for your colleagues. So I said we may not have all of the answers today. We do have some statutory customers with us, so if it's a question for one of those, I might throw it across to them. I'll let them introduce themselves as we come around to a question for them. But do bear with us if we don't have that. The reason is because it is proposals at the minute. We're still working through some of this material, and so all of your questions really help us do that. We really do want your views on this. There's a question I get asked a lot in our consultations. A lot of these things are proposals. They're very speculative, some of them. So we really want to hear your views. So please do respond to the consultation. So I'll start off by introducing the three of us. There is three of us actually doing some of this session, so we'll chop and change in between all of us. And that was just really to help all the material because there's so many different sections in here. So my name's Rachel Wilkes. I'm Head of Collections Development at JISC. And my team basically deal with all of the record reviews and handling consultations.
Right, I'm Lucy Van Essen-Fishman. I'm a Policy and Research Manager. So my team look at user needs for HESA data. What do people want to know about the higher education sector? What kinds of data might we need to collect in order to make sure that people have what they need? Over to you, Rihanna.
Hi, I'm Rihanna Phillips and I'm Collections Development Analyst, and I've been working most on the staff record.
Okay, so yeah, that's the three of us. So we'll just have a quick skip to the next slide to the agenda, and I'll just mention one thing and then we'll get started. So yeah, you can see there are lots of topics to discuss today. There are lots of information in the consultation itself. We won't be reading every single bit out, so feel free to please read the information in there as well. In particular, we've tried to be very clear where there is a statutory customer requirement for each of these things, and be very clear where actually statutory customers are interested in this data, but actually don't have a full requirement at the moment and want to explore it themselves a little bit further before making a decision on that. So for a lot of these areas and a lot of the questions in the consultation, we've opened it out to all providers to help with that point. So please do feel free to put your opinions on there, even if explicitly it might not look like your statutory customer is interested. They are potentially still interested and would be very keen to hear your views. But for some of these today, there are some very specific uses, and so we will mention those statutory customers as we go through. And that's enough introductions. Let's get started on the topics. So first of all, I will talk about the major review as a whole and what we're looking at there. So on the next slide, why are we actually doing this review? The staff record itself has had a major review quite over a decade ago now. It's been quite a while since we've done this. There's been lots of changes to the record in that time, changes in the policy and the focus it has on the staff data and staff in higher education. And there's been changes in the funding and regulatory environment as well. So it really felt like it was time to do that. We were getting contacted by lots of organisations that were really keen on different bits and having more information in the record. So that's why there's lots of different sections in this review. So on the next slide, it gives you a quick idea of the timeframes of where we are. We started off a couple of years ago in terms of identifying the areas and themes that we thought were going to be in the review. And we did that evidence gathering survey to test those kind of themes out with the sector. Responses of those are all published online if you haven't seen them already. Since then, we've been doing lots of engagement to work through those suggestions and put them into actual proper proposals. And that's where we are now. This consultation is kind of detailed specification changes, which we would like to test with the sector. So it is open and it will run until the beginning of April. After that, we will then publish the notification of changes, or it's kind of the outcomes of the review in the summer. So aiming for by the 1st of August, as we would normally want to do. So on the next slide, in terms of who should respond, it is really open to anyone, any provider or any organisation that is interested in staff data. So whether you send it or use the data, and the consultation link is there just in case you haven't already seen it. So now we will go into all of the specifics. So I am handing over to Lucy to start the first section.
Thanks, Rachel. Okay, so our first section of this Q&A is going to look at a couple of areas around coverage of the record, and I'm going to be starting off by looking at what the staff record does with non-academic staff. So on the next slide, we've got a bit about where we are now. At the moment, as many of you probably know, right, providers in Scotland and Wales, I'm going to do the slide from the bottom up, providers in Scotland and Wales must return data for staff on both academic contracts and non-academic contracts. So if you're a staff at a provider in Scotland or Wales, you need to be returned to the staff record, whatever your role is. Providers in England and Northern Ireland have to return academic contracts, but they don't have to return data for staff on non-academic contracts. But they may do so voluntarily. We currently receive non-academic staff data from, I think, about 55% of English and Northern Irish providers. All right, on the next slide, we're going to think about why this might be a little bit of a problem. So non-academic staff, right, are non-academic, but they nonetheless support providers' core educational missions. And there's been a lot of interest in this recently, particularly in areas around technical staff who may be involved in teaching and demonstrating. They may also play important roles in research. The new guidelines about submission of outputs to the Research Excellence Framework point out that outputs where technical staff have played a role in creating those research outputs can be submitted as part of an institutional ref submission. So there's acknowledgement there that the roles of these staff in research are really important. Non-academic staff can also be involved in a whole host of other student-facing roles, can do study skills, can offer pastoral support, can be librarians, can, all sorts of things. And the lack of sector-wide data on non-academic staff can cause a range of problems for different users. Right? They can make sector-wide financial forecasting very difficult because non-academic staff do still need to be paid. So if you want to do your budget or the sector's budget, you want to understand both the academic and the non-academic staff. They similarly can be really important in terms of longer-term workforce planning, and they can also be important in terms of EDI monitoring. There's a lot of interest in whether the same sorts of people from the same sorts of backgrounds are always going into academic roles and always going into non-academic roles. So there's lots of interest around non-academic staff. And we've therefore put together a range of proposals about non-academic staff in the staff record. The first one, which is the big one, is to return to mandatory reporting of non-academic contracts on a UK-wide basis. So bringing those currently optional non-academic staff in England and Northern Ireland back into the record. We are also proposing a change in terminology around non-academic staff. People, particularly non-academic staff themselves, point out that describing this big category of higher education staff in terms of what they don't do isn't terribly helpful and doesn't acknowledge the value of what they do. So we're looking to shift our terminology from non-academic, so a negative description, to a more sort of active, positive description of professional, technical, and operational staff. We're also proposing to split that professional, technical, and operational staff big category into two subcategories. One, technical staff, since there's been a lot of specific interest from across the sector and from our statutory customers in the contributions of technical staff, so we want to be able to find them in the record. And we also want to look separately at professional services and operational staff. The final proposal connected to non-academic staff is to implement some guidance defining technical staff and providing examples of the roles they may carry out. If we're asking the sector to submit data on technical staff, we need some guidance to let providers understand who should be submitted in this category. All right, so passing back to Rachel for our next coverage section.
Thanks, Lucy. So yeah, on the next slide then. So this section is around staff that are not directly employed by the provider reporting the data. We know there are lots of different arrangements in the sector with this. Currently, the coverage statement reads that a staff member must have one or more contracts of employment with the provider, and the provider must be liable to pay Class 1 national insurance contributions for that individual. And we have an exclusion list, which is what is on the screen here, for cases where actually you don't need to return those staff. But what that means is we don't really have a full picture of the sector. We don't have a full picture of who is being employed in higher education. And so what we want to do, and UKRI, Research England, OFS in particular, want a better picture of that workforce in order to know what's happening out there. So on to the next slide, a bit more about why we need to kind of make this change. The big problem is that a lot of core activity is not necessarily being represented and could be different arrangements across different providers. So thinking about the REF exercise, which will be collected via the staff record for the first time, which is great. It doesn't have information about those being employed through colleges. That's not collected in the staff record and actually would be valuable because it's relevant to the REF. We don't understand the role of self-employed or freelance staff with that, particularly where they're delivering teaching to students. There are other kind of increasing uses with our very changing landscape in higher education. We don't have data on employment practices, so we can't understand the pension liability and get estimation of sector level pension costs because of that. So having this data would help us with the financial forecasting and planning for providers. It means that we don't understand all of the employment practices that are happening there. So it does also mean that it would help us to make more accurate comparisons between providers because more staff doing similar roles would be together, whereas depending on the arrangements, they may be in, they may be out. So on the next slide, what we've tried to describe here is what would happen to that exclusion list. So a few of those would be crossed out as we're proposing explicitly to add them in. And there's one at the bottom there in yellow, which I've added, which is the staff working for affiliated organisations, which includes those in colleges. So we never explicitly excluded them from the coverage, but based on conversations, we know that they have been, maybe for other reasons, but they have been excluded from the coverage. So I'm putting on there because that will be kind of striked out as an exclusion in our proposal. So looking at what that would mean then in terms of how we would change that. So that's a massive coverage change. That's what we're proposing with there. But to help with this, we know that some of those arrangements may or may not need to be in. So for example, Research England might need to distinguish between those who are employed by a wholly owned subsidiary company or those who are employed by an affiliated organisation, because that second one is included in REF, whereas the first one is not necessarily included in REF. And a little note, so this field here, those are the categories that we are proposing to add. Hopefully that addresses a lot of them, but please let us know if not in the consultation. If something you have in a particular arrangement that isn't covered by this, and we might need to add that as a category, do put that in your consultation response. A little note for the self-employed or freelancers there. There's a suggestion in there about how much they should or shouldn't be included around delivering at least 20 hours per academic year, either through delivering teaching or some kind of assessment hours. And that's really just to help you not have to put every single hour in for everyone. So let us know whether or not that kind of suggestion works. So that's where we are with that one. I think that's the last slide, and that brings us to the final bit for this section. So over to you, Rihanna.
Yes, I'm going to be talking about medical and dental clinical academic surveys. So currently, the Medical Schools Council collects an annual survey of clinical academic staffing levels at medical and dental schools, whereas HESO also collects data on medical and dental school staff within the staff record. So at present, the overall coverages of the returns are different. So the MSc, their definition of clinical academic staff is narrower than the clinical definition used in the HESO record. And the MSc return only will consider staff who are registered to practice with either GMC or the DSC. We need to make sure that a common definition is used. And the MSc look at those with academic grades of lecturer, reader, or professor and are not interested in clinical academic staff who are research assistants. So the proposal. So for this proposal, we would like to consult to change to collecting only one return instead of continuing with 2 separate returns, as MSc would like to use data from the HESO staff return to minimize burden on medical and dental schools by not duplicating workload. So to collect one return, this would mean that we would need to collect GMC numbers in a new field and also create a new derived field to match the narrower definition of clinical academic staff than how HESO correctly defines it, which is as those on open-ended contracts registered with either GMC or the GDC.
Okay, so we are at the end of the first of the 3 sections. So I can see there's a couple of comments, questions in the chat already. I'll give you all a couple of seconds to think of your question and type it up, and then we will start addressing those questions. So I think what's best for the recording is we actually read out the question, and then one of us answer it, because I know you won't be able to see the chat on the recording later. So I will start off with this one then. The consultation mentions that the definition of academic contracts is well known, and this person's not sure that it is clear. They certainly have the same contract for all staff. So weeding out what's academic is a challenge for them. Will that definition be more explicit in future? And they're a small specialist provider, just to help with the context. Thank you for that one. So Lucy, I think that's in your section around the academic definitions. I think we did talk about this, didn't we?
Right, because I know we brought in a bit more, or we cited what we're currently saying about what counts as non-academic staff in the consultation. I think that's probably an important point and something we should be looking to do if we sort of start looking at the guidance. We don't currently have a proposed working definition of academic staff. We've got a working definition of non-academic staff. Actually, there might be one in the staff definitions. I'll have to have a look at that because I think there might be some information already on the HESO website. But I think as we're looking to redefine these categories, I think that's a good call for us to look back at our guidance and figure out whether that is clear enough. You're not, right, to Joanna who asked this question, you're not the only person from a provider where there isn't a contract level distinction between academic and non-academic staff. I think part of one of the things we started looking into at the beginning of this process was whether this contract level definition actually works for all providers. And I think the answer we came back with was that thinking in terms of contracts works for the majority of providers, but there is a significant minority for whom people just have contracts of employment, and figuring out whether you're academic or non-academic happens at the level of job specifications, which aren't, specifically written into the contract. So this is a known issue and a useful point. Our next question is, will the mandatory reporting of non-academic staff include atypical workers? And I think we are not currently proposing that. Correct me if I'm wrong, Rachel, but I think we're still keeping atypical as they are now.
I believe so. I don't think we've had discussions to change that. Okay, and the next question we've got there then, will the GMC number be optional as this person doesn't return it to MSc at the moment? I think when we were having discussions, they would need to use it to link it up to their data. So I think in the way we'd had the discussions, it would be mandatory. But if you want to put that in your consultation response and we can double check the options around that, that would be really helpful. Otherwise, I think they couldn't link our stuff up with their data and actually it would be more difficult to stop doing their collection. So yeah, that's useful to question.
So we've a few more questions coming in. Let's see. At an earlier webinar, someone made the good point that ACAMP fund relates to actual contract rather than work undertaken. Will HESA be changing the guidance or expecting HEIs to review and update their contracts to include the new groups? Shall we postpone that question into, because we're going to be talking at some length about how we record employment functions later on in this Q&A section. So I might sort of pause that question and bring it back later on. So Kate, if you've got some way to remind me that question exists when we get to the next Q&A section.
I will. And there's a couple of comments in the chat box as well, just to let you know about that first section. So yeah, I'll remind you.
Yeah, looking at the chat bit, the comments we've got there around definitely favouring the clinical return being added, as it would save a lot of work. So that's great to hear that support from that. It's something that we've talked about for a long time with MSc. Question though around whether or not you'd lump professional services and operational together, and would there be an issue with categorising support staff with AEF 1, 2 or 3? Is that academic employment function, I imagine?
Yep.
1, 2 or 3?
I think, watch this space, because we're going to be talking about that academic employment function marker and ways and the proposed changes around that. I think the grouping of professional services and operational staff together came mostly from the fact that we knew there was a lot of specific user interest around technical staff, and we were hearing less specific interest around either professional or operational staff beyond a desire to have them in the record and understand sort of how many people were in those roles and what their characteristics were. But please do let us know in consultation responses if you think there are specific things we should know about those categories, because this is something I think we'd be willing to take into consideration. We do want to get the categories right.
So a couple more questions coming in. One around the staff not directly employed by the provider section, and whether or not that is limited to staff in academic roles. So if not, it could mean a lot of extra work to collate this information for workers that are not doing anything academically relevant. So I think in our discussion so far, we haven't narrowed it down to academic or not, because of the fact, I guess, that in the previous section, we are considering kind of widening that. It's anyone who's involved in, teaching or researching or doing anything with students is kind of where the discussions have gone. So we haven't wanted to narrow that down, but I appreciate that doesn't help you. So I'm going to pause for a second and see if any of our statutory customers want to jump in on that. It's an area that we're still exploring with that, so it would be really helpful to know where those problems are. So if you and anyone else listening to this have got particular concerns about particular groups of staff, please put that in and we can have a look through that. So I'll pause for a second in case any statutory customer does want to add anything to that, but I think we're probably needing to take that away really and work through it. Okay, So the next question, where are we? How will the definitions affect which staff are in the staff-student ratios calculations? Yeah, I'm going to be completely honest with you on this one. We haven't worked through the implications of that yet. We know that's changed over the years, and particularly with Data Futures changing some of that. We haven't gone through that. What we've tried to target is where we would like to use the data and tried not to kind of let that steer us in particular directions. So it is something we will consider before making the decision. But right now, I don't think we've actually kind of worked through the specifics of what that would mean. We kind of need a bit more information from providers on whether or not we will or won't increase some of that coverage to kind of know where that's going. So that's still a work in progress. We'll make sure to mention that when we come back with the outcomes. Okay, we got a few more questions. Sorry, Lucy.
Yeah, no, I was just going to say much the same thing. Right, so looking at the next question, how does HESA propose we deal with the situation where those not directly employed are employed by a legally separate body and we do not have access to their data? And there's a lot of interest around this question. I think part of it is that the categories that we're proposing to bring back are still, for the most part, not directly employed, but connected to. So thinking about companies consolidated into the provider's accounts, wholly owned subsidiaries, where we don't, I admit, understand a great deal about the legal distinctions there, but that seems like an area where there should be possible information flow because the wholly owned subsidiary is, wholly owned by the provider. And that seems like it should be possible to figure out who's working. But please do let us know about the specific difficulties. Right, we're keeping the exclusion for agency staff because that seems, and seems from what we've heard from statutory customers, to be a bit further removed. So, right, I think we're going to have to come back to this one as we work through exactly what this will look like in practice and as we look at the consultation results.
Lucy, and I think that actually covers a few of the different questions we're getting in there about a self-employed, maybe honorary staff, or concerns about holding it on the system for other employers that are not maybe directly yours. I think a lot of that is the same answer to what Lucy's just given, actually. We need to understand where your concerns are with this so that we can kind of take that through in terms of making a decision. So we are kind of coming up to time. I'm going to keep us on track to make sure we get through the material. So I think I'm going to suggest we move on to the next section onto here. So I think we're starting with, the one we're delaying. So over to you, Lucy.
Right. So we've already started talking about how we think about employment functions. And I'm going to start out looking at what we currently understand about staff employment functions. Staff record, as you know, collects not just who is working in providers, but also what they do. What do we know about what they do? Mostly we use this ACEMP fun variable or field, which we've mentioned a couple times, which records the employment functions of staff with contracts in standard occupational classification. So SOC codes 1 to 3. So these are managers, these are professional roles, so lecturers, these are associate professional roles, research assistants, anything in those managerial, professional, associate professional categories. We don't collect any employment function data at all for staff with contracts in major groups 4 to 7. Right, current version of ACEMP Fun as it stands now has valid entries for academic contracts that are teaching only, academic contracts that are research only, academic contracts that are both teaching and research, contracts that are not an academic contract, and academic contracts that are neither teaching nor research. So on the next slide, we're going to look at why we might need to make some changes here. And there are, I think, roughly two big issues here. The first is that teaching, research, and teaching and research doesn't cover everything that academic staff do. And some of those other academic roles are becoming increasingly important in the sector. There's been a lot of work lately around areas of knowledge exchange, things around public engagement. We also know that academic staff often take on significant administrative and managerial roles. Maybe it would be important to collect some information about who is doing those roles. Right. The other major issue is that, as you might expect from a field called academic employment function, there isn't any detail there about what non-academic contracts are contracted to do. But we know that non-academic staff, professional, technical, and operational staff in the new terminology, are also likely to be involved in teaching, also likely to be involved in research, maybe playing important student-facing roles in student services and pastoral roles, may be involved in knowledge exchange. And as we know, there's some interest in understanding numbers of non-academic staff. We also know that there's interest in understanding what it is they do at providers. So we're looking to change how we record academic and other employment functions. I think most of these proposals are looking at ACAMP Fun and making it not just academic employment function, but employment function more broadly. Actual names of the new fields still to be confirmed, but just conceptually, we're mostly looking at a move away from academic employment function to employment function in all of our proposals except Proposal 1. Proposal 1 keeps things more or less as they are, all same field, same valid entries, but expands the guidance around not an academic contract and expands the guidance around academic contract that is neither teaching nor research, to give a bit more detail about what sorts of activities would fall into those two broadly other categories. Proposal 2 looks at expanding the ACAMP Fun field, probably renaming it because it's no longer just academic, but adding in new codes looking at technical roles and looking at professional services or operational roles. So looking at technical contracts with the same employment function categories that we have for academic staff, teaching and research, neither teaching nor research, and looking at professional services or operational contracts in terms of whether they're student-facing or not. We've heard from some of our statutory customers that this question about whether a role is student-facing is something they're interested in. Proposal 3, or option 3, looks quite a lot like option 2, but allows for some multiple choice around employment functions. So, if you have a technician who has responsibilities for teaching research techniques and also managing health and safety in a lab, they can tick both teaching responsibilities and also neither teaching nor research responsibilities to cover their other responsibilities. We know there are some issues there in terms of continuity of data. Multiple choice fields are complicated, so we've put this option in, but we understand that there would be some difficulties around implementing it. We're not strongly voting for this one within ourselves. Our final option, and the one we actually do think will give us the best balance of more detail, more flexibility, and better continuity with existing data, is to replace the academic employment function single field with a bunch of new fields. So several fields looking at contract type, flagging whether it's an academic contract, yes or no, is it technical, yes or no. So different fields for academics, technicals, and professional services staff, a field looking at whether the contract is involved in knowledge exchange, a field looking at whether they're student-facing, and one more field looking at main employment function with a variety of different options. So while that looks quite different and complicated, it does all pretty much map onto the existing categories with some new detail. Right, over to you for SOC codes, Rihanna.
Yeah, so currently The sort codes are included to aid in the understanding of the roles performed by higher education staff, and it's collected to 3 digits. So why do you need to make a change? So firstly, needs of funding and regulatory bodies. So UKRI have a requirement to collect more detail of source codes to help understand the activities of researchers, professional services, technicians, and other key HE staff roles. And how would this help? So with 4-digit stock codes, to provide UKRI with a better understanding of how the higher education system operates and help UKRI tailor its policy and funding strategy. So our proposal is for stock codes to be collected at a 4-digit level for all contract activity records instead of the 3 that it currently is.
Okay, back to me again, this time looking at our next big section, which looks at careers in higher education. So the first part of that is going to be looking at how we track staff from year to year of the staff record. So what do we do now? At the moment, the staff record, as you all probably know, does not collect names for individual staff members. This is in contrast to what we do in student, where we collect names for the purpose of linking records from year to year. Each record, or each individual in the record, instead of having their actual name in there, has an anonymous staff ID number. It's created the first time someone's entered into the staff record, and it should be passed to their new employer if they move from one provider to another. Although we know that there are difficulties in this and that doesn't always happen. We also collect ORCID, that's Open Researcher and Contributor IDs, on an optional basis where staff have them. ORCID is a system where staff have to sign up themselves, so not everyone has them, and the people who do are only people really involved in research. This combination of identifiers and lack of identifiers means that it's tricky to keep track of people from one year to another. Why might we want to keep track of where staff go from year to year? So next slide, we're thinking about why we might need to make a change. There are some needs that we have from our funding and regulatory bodies, from our statutory customers, and there are some needs that we've heard from providers and other sector bodies. So UKRI are interested in understanding the careers of researchers, so how people move from one post to another. The Welsh Government has mentioned being interested in understanding movements, particularly out of the higher education sector. And Scottish Funding Council is likewise interested in tracking progression between roles and between providers. Looking at what providers and other sector bodies want to know, understanding career progression can help support staff at different career stages. It can help out with workforce planning, recruitment and retention. It can also help out with, because tracking careers can help you understand who progresses and at what stage in their careers. This can help with promoting equality of opportunity. If we know that certain categories of staff tend to sort of stall at certain stages in their careers, maybe providers can put in some more support where it's needed most. So we've got a whole load of proposals, which I'm going to go through very quickly about this. The first, I think 5 of them look at ways we might be able to improve staff ID to make it more reliable in terms of tracking from provider to provider. And then there are a few other proposals that look at other options for identifying staff in the record. So the first, proposal 1A, is a fairly simple one, and it's just to ensure that the directory of staff identifiers contacts is kept up to date. We've heard that gaps in this directory are one of the difficulties that providers face in getting staff IDs from new staff. So if we can keep that directory up to date, that will help with getting staff IDs from one institution to another. Proposal 1B is similar but slightly more forceful, and it's that we should make it mandatory to include staff identifiers contacts in the directory. So if this were mandatory, if statutory customers helped sort of put some clout behind making this mandatory, that might make providers more likely to keep things up to date. Another option in there would be to implement an expected response time for providers to respond to requests. So maybe some people are, have the full intention of sending over a staff ID for a new staff member, but it takes a while and it gets lost in the shuffle. Can we get an expected response time in there? All right, proposal 1C is around encouraging data protection teams to engage with JISC around concerns around sharing staff IDs. One of the things we've heard is sometimes a problem is that previous employers are cautious about, or can be cautious about, sharing staff IDs with new employers because of data protection concerns. And we're pretty confident that if people were to talk to us and talk to our legal team, we could sort of ease those concerns. But those lines of communication need to be open, and we need to encourage people to get in touch if they're worried, rather than just saying, our legal team has told us no, there's nothing we can do here. So proposal 1D is to look at encouraging staff to have a sense of ownership in their own staff IDs. If staff know and care about their own staff ID numbers, then when they move from one institution to another, they can report to their new employer, here I am, here is my staff ID from my previous employer. So this would involve some outreach to staff, also thinking about systems and processes to make sure that staff knew their staff ID, knew that this is a thing. But it might be a way of sort of adding an extra approach to the transfer of staff IDs from one institution to another. But 1E, our final proposal around improving staff ID, which came to us during some of the workshops we held over the summer, was to develop a central database of staff IDs, which would be maintained by HISA, linking staff names to their staff IDs. Heard the names word there. We'd probably need to collect names for this, but the people who suggested a central database to us over the summer seemed more comfortable with the idea of giving us staff names to be stored separately from the staff data as a whole, just for the purpose of linking to staff ID numbers. So that might be a way forward. Next batch of proposals look at other possible identifiers. Proposal 2 would be to mandate the collection of ORCID for staff engaged in research. So this would improve tracking for research active staff, which is an important goal for UKRI. The only problem there is that it's not really feasible for staff not engaged in research because they don't have any incentive to create their own ORCIDs. So that would help with tracking just in one area of the workforce. Proposal 3 was around using hashed national insurance numbers as the key in a central database of staff IDs. We haven't, to be honest, fully worked out how this would work, but the idea is that you can use data hashing to take national insurance numbers, which are highly personal, highly sensitive data, and return an anonymous, not back traceable ID, which could be linked to a staff ID and would get around some of the data privacy concerns around collecting national insurance numbers. And this is a fairly tentative one, but it's been suggested to us, and we're interested in hearing how people respond to that idea. Our final proposal is that if we can't improve staff ID to the point where we can reliably track staff from year to year, then we'll think about introducing names to the staff record. We'd like to improve the quality of staff ID. We know this is what a lot of users and providers would prefer, and we're going to sort of see what we can do between now and the implementation of the review. But if we can't do that, we're going to look into we're proposing to look into the possibility of adding names. All right, deep breath, and then I get to do another section. So next section, also looking at careers, but looking at fixed-term contracts. At the moment, for any contract that's in the staff record, we have a terms of employment field which looks at whether the contract is open-ended or permanent, fixed term or atypical. We've got a start date field, which records the date on which the contract began. And if a contract has ended in the current reporting year, then we've got an end date for the contract. We also have information about the reason for an end of the contract. And if the reason for a contract ending is that it's at the end of a fixed term contract, we find that out. Right. Why might we want to change this? We know there's quite a bit of interest around staff on fixed term contracts, particularly around progression. So linked a bit to what I was saying before about tracking staff from year to year. There's some curiosity from, again, particularly UKRI about progression from one fixed term contract into another, or from one fixed term contract into a permanent contract. There is also some interest, which we can answer using our current staff data, about the personal characteristics and EDI qualities of staff on fixed term contracts. Are the same people always ending up on short term contracts? At the moment, we can understand contract length retrospectively once contracts are over, but we can't understand how long a contract is going to be before it's ended. And this can have implications for workforce planning, and it also has implications in terms of understanding employment conditions. There's something quite different about being on a 6-month contract, where you need to look for work in another 2 or 3 months, and being on a 5-year contract, which lets you make some longer term plans. We also have heard that our current options may not cover all relevant types of contract. We've heard from some statutory customers that there's a category of contracts that are technically open-ended, but in practice they're tied to the continuation of grant funding, and we can't currently capture those contracts in the record. They just show up as open-ended. So we've got a couple proposals here, right? 2 around contract length and 1 about types of contract. So the first possibility for looking at contract length would be to introduce an expected end date field, so that if a staff member is on a fixed term contract, the provider would report not just the start date, but also the expected end date. This matches what we do with governors at the moment, and this would make it possible to calculate the length of contracts. Second option is, instead of including a specific date, we can include a length of contract field. So that puts the length of contract into a number of possible ranges. Our final proposal in this area is looking at capturing that final category of fixed term contracts. So we're going to propose to add an extra valid entry to the terms field for an open-ended contract tied to grant funding. And I think that's it for this section. So
that's just me over to visa status and then finished. Thank you, Lucy. So what we're doing around visa status at the moment, nothing is collected in the staff record. We know that providers will be collecting this data because you'll be sending it directly to those who need that, but not actually in the staff record. So on the next slide, the reason that we are looking at making this change is because DfE and UKRI are particularly interested in this. For DfE, it will enable them to monitor how changes in visa policy impact the composition of the higher education workforce. And for UKRI, it would help them identify trends in visa status, for example, where they're moving between visa types. And it would feed into their annual Global Mobility Evidence Report. It would also help them develop the visas that they do operate and help them to better advise government on mobility and visa policy, particularly where that's around research and innovation. So looking at the proposals we've put in here, there are 2 things. So the first one is around the types of visa, and we've got a couple of options here. Simply a kind of marker flag to say that these members of staff have a visa, and a couple of reasons why they might be excluded from that. And the second option is a little bit more detailed, which actually breaks down to which of the visas a member have. So clearly that option would help UKRI a little bit more because you'd be able to see where people might be moving between different visas. But also the duration of the visas would be really helpful, again, particularly around UKRI funding and knowing how long the visas are for staff members. So on the next slide, we've got a couple of options again to collect a date field. for that end of the visa. And the second option would be to kind of collect date ranges, so trying to simplify the collection of time, I suppose. I'm kind of putting them in buckets instead. So that's the end of this bit. I think we over to another questions slide. I can see we've had lots flooding in, so we'll address as many as we can now. As I said at the beginning, if we don't get round to your question, we will answer it and put it up on the website later. Okay, I just need to find where we stopped answering the questions. I think, Lucy, there are a first few more for around academic employment function. And do you want to address that one from earlier now?
All right, now I'm unmuted. That's a good first step. Right, so earlier's point about ACAMP fund relating to contract rather than work undertaken, we'll be changing the guidance. And I think the quick answer is that we don't know yet, but I think that will depend a lot on what we hear from consultation responses. I think there is and this is me speaking as me rather than HESA, but sort of speaking on the basis of what I've heard from users and providers and various stakeholders over the last couple years, that I think there is probably an argument for moving a little bit away from language of contract in some of the fields for the staff record and thinking about, can we think about activity rather than contract, if that's a more accurate reflection of what staff do and how providers are understanding what staff do. But I think the real short answer is we need to look into it, and we don't know yet. But depending on what we hear from respondents to the consultation, we'll be able to issue further communications about that. And please do let us know in your responses if you think sticking with contract works with your systems, works with your existing understanding, or whether it would be more accurate or easier for you to think in terms of work undertaken. So
we start the next questions then. There's one here around whether or not academic employment function changes, that you'd like a lot more guidance on how to classify the contract, because the current guidance is not very clear and has potential to invalidate the accuracy of the data. I mean, absolutely, and that goes across a lot of these proposals, particularly where we're going to change some of the existing kind of ways of looking at things. We will have a look at doing lots more guidance, maybe lots more examples, and would be really keen to work through with some providers that are actually picking that out. So absolutely, we will do that. And you tell us where we've got it missing. Put it in the consultation response, actually. That would help us identify where you want us to pick that out.
Okay, and we've got another similar question on whether it's still intended to be based on the contract. As this respondent says, they wouldn't be able to code any technicians in options 2 to 4 as we have one professional service contract that includes technical staff. So that's actually, right, similar point, but a really good argument for why thinking in terms of activity rather than contract could be really valuable if this data is data that users need.
There's some support in here for our option 4, which is collecting lots of data on the academic employment function there. There is a question here about what the practice meant. Rihanna, I don't know if you can skip all the way back to the slides so we can show it, and Lucy, whether you have anything on that, but I think it was one of the categories in option 4.
Right, I think that's where I've heard that term used has been around often staff in things like theatre departments who also direct plays or act in plays, staff who have a kind of active role in the field that they're teaching. But I think that's definitely an area where we'd all of these categories that are new, we'd be looking to put in definitions and guidance around what do we mean by this. And I think the exact list of main employment functions there is certainly still subject to confirmation, and we'd really be keen to hear from you. If we were looking at what what the main employment functions we ought to be recording are. What would be the useful ones? What are the categories that exist in your providers that you feel need to be captured? So we've got a question on expectation with regard to external reviewers, exam invigilators, student support workers, etc. And I think we're going to have to go off and think about those a little bit more. I think student support workers I would understand that as a sort of professional services role that is student facing. External reviewers and exam invigilators, I think I need to think about this. I think external reviewers sounds academic to me, and exam invigilators is borderline, having been a student exam invigilator at some point. Yes, I was monitoring academic activity, but my activity itself wasn't academic. So I think we'd need to think about where those borderlines are.
And so any examples like that in the consultation would be really helpful for us to work through. Okay, I'll try and address some of the next questions. I can see there's a question in there about some of these requests coming from a lot of UKRI requirements and whether or not that would mean providers that are not necessarily research providers would need to do that. We will be very clear when we announce that whether that is the case. If you're not regulated by a particularly statutory customer and they have requirements for that data, then you wouldn't be expected to return that. But as I said to you, all of the statutory customers are still working through some of this, so we may change our position when we come around to making decisions. So do feed some stuff in if you are concerned, particularly around that. But yeah, we will make that very clear when we make the announcements. We've not got too much time for questions in this section, so I'm going to skip to, there's a few coming in around the identifier section. My favourite one here is around why can't just send out a letter of every institution's legal team setting out why sharing staff ID isn't a GDPR issue, and why wait for them to ask for that information before raising those problems. This is absolutely something we could do, and yeah, okay, we'll take that on. I mean, I guess from our point of view, that information is in the data collection notice, so it feels like we're sharing that, but I absolutely get the point. If we're going to make a real push to get staff ID better, looking at some of the other comments in here around other identifiers not going to work and not having a good idea of collecting them, we want to get staff ID working. So if we want to make a push of that, it gives us a real reason to kind of send a new letter out with that, that information out there. So absolutely something we can take on and look at. Sorry, my computer's frozen. I'm trying to load the next questions and I can't make them load. Lucy, I don't know if you can read the next one.
Right, so question on, we've got a number of identifiers, questions. Right, there's a concern around a major downside of adding names is that we'd no longer be able to say to all staff that any information we collect is anonymized before being shared. This is something we've heard a number of times, and I think, Aaron, it is something we need to hear about and will take into account. I think one thing that I continue coming back on here, I do understand this concern, is that we do also collect a range of personal data around students, and we collect their names, and we've talked to statutory customers around their sort of data storage and processing policies, and their, it's standard practice once you get a data set that has names in it to sort of strip out the names, store them separately, use them as a key. So we understand that the risk is there, but it's a risk that we feel that the sector sort of knows how to handle with student data, and we're curious to sort of keep exploring why, when it comes to staff, this is more difficult. And yeah, we genuinely do want to understand this and see what we can do to mitigate concerns here.
Do a couple more and then we'll have to move on to the next bit. There's a question there around how the range of possibilities for the length of contract would be better than returning the exact length. I think there's a couple of bits where we've done that in here, and I think the idea is the exact date and the exact length would probably be preferable, but we understand that people may not record it in that way, may not want to send it to us in that way, and so we were trying to give another option where actually we could bunch them all together but still use that in a meaningful way. So yes, that may not be possible for your provider, but it may be different for other providers. So that's why there are two options in there, and I think there's an obvious, better one from our point of view, but we don't want to just kind of go out with one proposal with some of this because it is quite a change. So that's why that's in there. There's one more question, which I think I will take as the last question, unless there's anything else you want to answer, Lucy, was around the software suppliers and how much they've been involved in the feasibility of this. So we have sessions regularly with software suppliers and any in-house providers that sign up to that same list. We mentioned this to them a couple of weeks ago that this session today was happening, and so we were going to share this information with them first so that they could understand what the proposals are. And then we will talk to them about the feasibility and any changes from their perspective. We've made more of a point of doing that when we do major reviews and consultations, so they will be asked to input on that. I think, and Lucy, unless you've seen any of the questions you think need to be addressed now, I think we will move on to the next section.
Yeah, I think, and there are definitely some good questions in here and ones that we're going to want to take back and have a look at. But I think we've more or less, I think some of them are on similar lines to questions we've already addressed, and some of them are going to need some more thought anyway, so we may as well move on.
We'll do that then. Thank you very much. So I think for the last section, we're starting off with Rhianna.
Yes, I'm going to be talking about personal characteristics data for providers in Northern Ireland and Scotland. So as you can see on the screen, I've got here about the coverage. So we've got mandatory and optional for different nations. And there are also other personal characteristics data collected, such as date of birth, disability, ethnicity, nationality, parental leave and sexual identification. And our proposal is to bring align most of the personal characteristics as best as we can. So as you can see here, so why do you need to make the change? So within the staff record, we've been looking at aligning the coverage of data items such as sexual orientation, gender identity, and marital status to give us a UK-wide coverage of data. And in the personal characteristics and equality data consultation that was run in spring 2021, the answer provided, it was clear that there was a preference to make these data aligned across the UK and across the HESA records. So currently, for providers in Northern Ireland, the proposal is to increase coverage for the gender identity, sexual orientation, and religion or belief fields to be mandatory. And for providers in Scotland, this would be to make it applicable for all staff returned in the staff record. However, this being said, there will still be the option for staff to use prefer not to say option. And now I'm going to talk about dependents. So our current position, so currently there's not any information collected on dependents in the staff record, but there is in the student records. And the reason why we need to make this change is because DfE would find it helpful to have contextual information about whether or not staff members are bringing dependents with them to the UK. So our proposal, so we propose to have a new field marked up with student dependent and entry profile dependent fields that are in the student record. And as you can see on the screen, there's the different codes and labels.
Okay, and the next section then is on governors data. So we've been collecting governors since 2017 with the various coverage options that are there. But the data on governors has become increasingly of interest to the sector, especially where we want to understand the diversity of governing bodies in higher education. And the lack of data, and particularly consistent data, reduces the ability to see that complete picture. In particular, we get an example in there around advanced HE and the diversity of governors in HE report that they do. there are other requirements as well. So MEDA is considering changing their regulatory requirements in respect of having something in there about adequate governance and management, and that will be included in the condition of registration in future. And so having more detail on governors in this staff record will provide one source of that assurance for them in terms of what governor data we have in higher education. So on the next slide, sorry, I think I've just read that one. Yep, that's the one I just read out. So that's why we need to make the change in terms of what the changes are. Skipping to the next slide. We have a couple of things looking at here. So the first one is around the types of governor in terms of where their background, where they're coming from. So are they a staff member, are they a student member, or otherwise? And that helps us understand where those people are being pulled from. And the second proposal on the next slide is around the role of that governor. So are they the chair, are they the vice member, or are they the vice chair, or are they another member within the governing body? And that would just help us kind of picture where all of those roles are happening, and therefore their diversity information and where those roles are sitting in that. So that is governors. Yeah, I think back to you, Rihanna, for this one.
Yes, so our current position, so we currently collect data on those who are able to and those who do teach through the medium of Welsh. And with the FSC, they're currently seeking information on the role of Gaelic in the university sector. There's seen an increase in the number of people speaking, learning, using and supporting Scottish Gaelic in Scotland. So why do you need to make a change? So in both Wales and Scotland, there is a desire to identify and collect data from those who either speak Welsh or Gaelic. So we have our proposals on this slide. So MEDA, Welsh Government and the SFC are still working on receiving the exact information that they require on their respective languages. And for our consultation views, we are only seeking views from relevant providers about their support in principle about doing this only.
Okay, and back to me. So this is the section on the REF 2029 requirements. So this is where we've got a bit more understanding on the sabbaticals and secondments section. So where we are with that. So alongside doing this staff major review, we've been working with Research England to make sure that all the data is going to be, as they require to do the REF 2029 exercise. And so a lot of that has been announced already in the 24-25 notification of changes, those 3 changes, which are all on contract. I know there's a bit of confusion about moving them to person, and then we moved it back to contract because actually that made sense. That bit is all there. What we have been working through with them since that announcement was making sure all of those fields that they need to do for all of their different metrics are actually collecting the right data. And there are 2 gaps that that they found and highlighted to us. So the current guidance we have on FTE there shows that if staff are on sabbaticals or they're seconded outside of the provider reporting it, ConFTE would be reduced to reflect that. On the next slide, it just takes us through actually why that's not working for the REF requirements. So Research England want to make sure that any activity that is doing research, any research activity is actually captured so that can go forward in the metrics when they're estimating the research capacity of a provider. And so the time that staff members have spent on that with our guidance is to actually kind of remove that from the ConFTE field. And we don't have another way of capturing that field. Obviously, they would like that to be captured so that they can then put that towards their metrics. So I will note on here, there is a question in the consultation asking providers whether or not you are following that guidance. And I want to make it really clear that we are not asking you that question because we're going to come and follow up on your data quality. We're asking that question because we want to understand the scale of what's going to change in ConFTE. If lots of providers have been missing that guidance or not been able to follow that guidance for whatever reason that is, we just want to know that so that we know how much ConFTE is going to be changed with these requirements. So I'm just putting that on the recording there so that you've got it there. That's why we're asking it. We're not going to come and follow up if you particularly mention things in there to us. And the last bit to mention on here is that this one is earlier than anything else. These need to be implemented a year early, so 25-26, because it is that year and the following year of data that is being used in the REF 2029 exercise. And so if this is going to be changed, it needs to be kind of there at the beginning of that period. So there are two ways of doing this. Now on to the next slide. Thanks, Rihanna. One is to just have one more field called something like REF FTE to capture any of that time that might be spent on research-related things, whether that is sabbaticals or secondments, so that we've got somewhere to put it. The time that is recorded in this field, we would then expect to be reduced in Con FTE. So there's no double counting between the two, and that's where we need to see the impact, how much that Con FTE might be changed as a result of bringing this in. This field would only be required from those who are submitting to REF, sorry. It wouldn't be required from those who are not involved in that exercise. We would expect, because this is a recording activity that could be captured for REF, it's likely that the contracts that are using this should be flagged with the new REF Qual Con field, and that's one of the ones that's in the 24-25 announcement. We'd expect it to be flagged there because that's why you'd be wanting to return some activity in this field. And the second option on the next slide is very similar, but really we're splitting that into two fields. So one capturing the sabbaticals FTE and one capturing the secondments FTE, so that we would know why that was kind of reflected. And all the other things would apply. So again, Con FTE be reduced, only required from providers submitting to REF, and we'd expect that the REF Qual Con field would be returned for any stuff that you're putting in these two fields for. So that's where that one is. We have one more section, which is around the year of implementation. So there's a bit at the end asking you questions around this. So on the next slide, it just takes you through a few points. So I've just mentioned the REF changes. That one is separate from this. So that must be implemented in 25-26 because of the fact it's needed for the 2 years of data that will be used in that exercise. But everything else we're proposing could be from 26-27 onwards, on the assumption that we do make the announcement by the 1st of August this year. But we are aware, and there was one of the questions in the chat was around lessons being learnt from previous projects and making sure we understand the capacity of providers and whether or not they are able to make some of these changes. That's why we're asking this question here. So any information you want to tell us around that kind of thing, your capacity about other changes, please do put in these questions here. We want to make sure our data is relevant, it's up to date, it can be used for the latest thing that statutory customers require it for, but we appreciate that there's a lot of change going on at providers, and therefore you may or may not be able to do these for the time we want. So this is where we want to kind of understand those views. Please do put some explanation text if you can, if you tick one of those boxes of the timing, because it really helps us understand why you've done that. And so we can pick those apart, see if we can resolve any, and if not, that might feed into our decision. So the final slide today is where I've pulled out all of those changes. I've used this in a few presentations recently. These are all the kind of things that are happening in the coming years. So a lot of the student record at the top, but I've got all the staff ones at the bottom. The two ones in red are this consultation. So obviously they're in red because they're still proposed. They're not actually there, but everything else on that slide has already been announced or talked about or is a known thing. So it just demonstrates that there are a lot of things happening. So there's the information there if you want to use that in your response. But yes, that's where we are with this. There's always a couple of questions right at the end for anything else you want to tell us. So if there's something missing, there's something you think should be different, or you just want to tell us something around this, then there's always a couple of questions at the end for you to add anything extra. And I think that is the last slide. I think, yes, cool, questions. So have we had some more questions come in? I imagine we have. Trying to find where we left it.
So we started out with a question looking at dependents, saying if a particular government department are looking for information about dependents coming into the UK, would it not be more effective to collect this as part of the visa process via UKVI? So, and I guess the things I can say about that off the bat, again, all subject to sort of further thinking and the written out version of this will hopefully have some more detail. So one thing is that, yes, this will be collected when people apply for a visa. There are linked dependent visas. It's general getting that data sort of linked back to industries and providers isn't always straightforward. So there's sort of communication between departments issues that might make collecting it via the HESA staff record more practical if we want to if the DFE specifically wants to understand dependents coming in with international staff. Right. The other thing is that the dependents question, while the stated statutory customer need is about dependents of international staff and who are people bringing with them on visas, it's also been raised in our preliminary conversations with users of the data as a more general EDI issue. And what do we understand about staff who have caring responsibilities more broadly, not just international staff, but what do we understand about, say, career progression for staff who have children, or career progression for staff who are caring for elderly parents? So there's a later question about how personal and potentially intrusive this data is, and we fully understand that. I'm going to sort of try to take these two together. And I think part of one of the things we're hoping to do in this consultation is figure out where the balance is between data that would be useful for understanding the workforce, understanding employment conditions, understanding equalities monitoring and progression opportunities. Where's the balance between the value of that data and the burden of collecting it and how personal and sensitive it is? And right, you can help us understand that, because I think there are some really tricky points in there. The question raised an issue about what happens if someone has a child who passes away. Isn't that's an awful thing to be asking about. Do you still have children? That's horrible, and we need to figure out how to handle things like that sensitively.
Thanks, Lucy. The next question I can see in here then is around, could the requirement for either end date or expected end date be dropped for governors who are ex officio, can't read the word. It's a good question. I don't have an answer to that. It's not one that we've explored, so we can definitely take that away. Where's the next one? Just that. Next one I can see then is a suggestion of around the Research Excellent Framework one, or just don't ask us to reduce ConFTE for sabbatical research activities. That's a good suggestion. We did think this through with Research England, and they're not here today, so I can't throw the question across to them. But there was a reason why I think the FTE field, the ConFTE field, we wanted to stay as it was, and therefore we needed to collect this separately. But I will double check that logic, and we can give you an answer on that. I guess it is still an alternative option, though, isn't it, for us to make sure we've looked at that. Another bit of feedback here. As the ref volume measure is in partly in 2026-27, worry about the major changes in a return year, which is so important for ref. Yes, and it's a discussion we've had a lot with Research England between getting the right data and getting the data in at the beginning so that it's there for both of the years. Research England have done lots of engagement with providers working through some of these things, so they may have some more information to feed on that. But it's certainly something we've borne in mind when we've been thinking through these. I see a couple of questions there around software suppliers, their timing about being able to respond to these changes and actually committing to when it will be in there, and that being vital to knowing whether or not you can then do this. I mentioned earlier, we will definitely engage with them. Hopefully some of them are here today or will be listening to the recording. It is definitely something we want to look at, and we use that as one of the things we need to have before we make a decision. So absolutely point noted, and we will work with them to get those. A couple of questions around the timeline that I put up in there. It's inevitable, isn't it? I put one up there and there'll be stuff off there. So there's a question there around where does data futures feature in the timeline? I guess because data futures was implemented in 22-23, I missed it off the timeline. But you were right, there are knock-on impacts still happening with that, so maybe I should put that on my next version. But that's why it was, because it started in there, I was just doing from like today onwards changes that would be reported to us in future. So yeah, point noted on that. We can add that in.
A related question, would like to understand if there are any plans to bring the staff collection into in-year returns also. And the
No.
firm answer is no. It's really nice getting a question that I can answer decisively.
Yeah, nobody has told us that. So unless our statutory customers are about to surprise us, which I don't think they will be, staff is not coming in year. Actually, I'll take the moment to say something we've been asked before, and just to clear it up, the Data Futures project was about moving the student record and the system for 22-23. So we're not doing data futures to staff, if that makes sense. That's the question I've been asked. That was a very specifically student project. So this is the staff review, and all of the material we've gone through today is that. So if we haven't mentioned it today, it's not something that is on our radar and isn't something being considered. One more question I can see around the timeline about including the in-year proposal and the fact that we're doing a consultation in the spring this year around that. Yes, very valid point. I'll be completely honest. I did the slides before I thought of putting that on here. So yes, it should be there. Simply timing of when I did the slides to write them up with it. But you're right. So just for the recording's sake, that is looking at doing 27-28 as the earliest point that in-year could be brought in for the student record. But yes, I will add that one on as well.
Are we going to continue to use the existing portal to return our staff data then? I believe the answer is yes. Is that?
Yes, for now. That is a yes for now. That is something we are still working through. And one of the reasons actually we've been drawing up that really big timeline is when we move stuff onto the new HTTP, it will go on the HTTP at some point. The question is when. And so that's something we're looking at in terms of this major review implementation. Do we try and move staff on before then or after? And there's lots of things we've had to consider as part of that. A big chunk of that is to do with our own resource and actually being able to get it on there. So it will move at some point. I can't definitely at this say when, simply because we haven't kind of made that decision. So I don't know the answer to that one yet. I can see one more question here coming up around, do we have a list available to check the software suppliers? Not exactly. Basically, we have a Teams channel set up to do that. So I've got a list of where we are. The best thing probably to do is for you to email liaison with your software supplier and check ask them to check that it's on the list. And if not, then we can work our way around doing that. That's probably the best way to do it, rather than us trying to send you the list, because that doesn't really exist in a form that's very easy to share. But absolutely, please do that if you're worried at all about them there, or you're an in-house provider listening to this and thinking I'm not on that channel. Please do get in contact. We can add you to that as well. I think the last one I will finish on, unless we get any more in. Someone missed the start of this session. Are we being sent out something to complete on these, to comment and kind of vote against them? Yes, there is a link at the beginning of the slides to the consultation. So please do put in a consultation response, whether you're a provider or a user of the data or any other organisation out in the higher education sector and want to put your views forward. Absolutely happy to do this. Please do that. So yeah, the link is at the beginning. But you can find it on our website. There's a reviews page where we put all of this on there. So it will be there as well. If you can't find it, email liaison and they'll be able to drop it to you. It should also have been linked to in the weekly update email as well. We launched it in January, so there definitely would have been a link back there. There was a link to today's session in that as well, so you should be able to see it from there too. Okay, I'm going to pause there. Lucy, can you see any other questions that we can answer
one more
now?
has just come in to say, can consideration be given to requiring non-academic staff data only for new starters? We've not been recording some of this information since it became voluntary, and trying to get it off every member of existing staff is going to be challenging, as most of the data is collected at recruitment stage. I think that's something to think about. I think it also would have, I certainly see how that would work in terms of making things more practical for providers submitting the data. I know there would be sort of a transitional period where coverage would then be quite patchy for staff who were employed between 2019 and 2027. So I think we'd have to think about that, but we will think about that. So thank you. It's an interesting proposal.
Okay, I think we are nearing the end of the session. I'm just going to pause for a moment and check with any of the statutory customers that are here today. Is there anything that we've missed, or you want to clarify today? Is there anything you want to jump in and just stay whilst we're here? I think you can unmute yourselves, but if not, you can put your hand up and training can do that. So I'll just pause and give you a chance to come in if you'd like to. Anna from Meda.
Just to say, encouragement to the Welsh providers to submit the consultation and give us as much detail as you can, so that we can sort of look at the responses and make decisions that suit everybody. So, thank you.
Thanks, Hannah. Okay, I think then, as we're nearing the end, we know there are a few more questions in there, but as I said, we will definitely answer them and put them on the website if we've not managed to address them today. I will just then wrap up and say a really big thank you. Thank you to Rihanna and Lucy, who are presenting with me today, but thank you also to providers and other organisations that are here and asking those questions, because we need these questions. We need your feedback in the consultation. Otherwise, we can't make good decisions. So thank you for coming today, and thank you in advance for your consultation response. And I'll give you an extra minute back. Thank you very much, everyone.